So if you're thinking about getting Botox but don't know where to start, this video series is for you. I'm Dr. Toral Vaidya and I'm a board certified dermatologist, and Botox is one of my favorite procedures to perform but also receive as a patient. So I'm going to tell you everything that you need to know to get you started. So first, you should understand what Botox is and how it works. So Botox itself is a neuromodulator, and that essentially means that it acts on a signal between the nerve and the muscle. So when we make expressions with our face, it's causing muscles in our face to contract, and when our muscles contract, this causes the overlying skin to wrinkle. What Botox essentially does is it prevents that muscle contraction. So by relaxing the muscle, it essentially prevents that overlying skin from wrinkling. So what's important to understand here is that Botox is acting on that active muscle contraction that causes those wrinkles in the forehead or those 11 lines here, for example. So when you're relaxing those muscles, you're preventing those wrinkles from forming and preventing them from getting deeper. So now that you understand how Botox works, let's talk about areas that are commonly injected in the face. So the forehead is a common area, and the glabella right here that you see those 11 lines forming. Also crow's feet right here, bunny lines along your nose. In terms of the lower face, a common area where Botox is injected includes the chin to prevent that wrinkling of the chin. Also right here to prevent the downturn of the mouth. Also the masseter, a very common area of injection. By treating the masseter, you can treat TMJ, teeth grinding, but also create a more slimmed appearance of the face. There are other ways Botox can be used to enhance subtle features of the face. For example, you can use it to get a slight brow lift by injecting a muscle right around here. It also can be used to give a sort of a lip flip by injecting right around the lip, or even correct a gummy smile by injecting right around here. So there are many interesting ways Botox can be used on the face, and that's why I love it so much. All right, so now you've decided that maybe you want to get Botox. What should you expect during your appointment? Here, I'm going to act like you're my patient. With every single patient I see for Botox, even if I've seen them before, it all starts out with a consultation. I'm really just looking at how they talk, how they naturally move the muscles in their face. I'll also ask them to make some expressions, including smiling really big, making a concerned face, raising their eyebrows, so I can really see what muscles are really active. After that, I'll map out the specific areas that I want to inject, something like this diagram right here of my own face. So in terms of how much Botox is injected, it really varies from person to person, and everybody has unique anatomy, uses their facial muscles differently. But for you to get a sense of how much liquid is being injected, this is about 12 units total, about 0.3 cc. So the next question you might have is, does it hurt? And really you might feel a very small pinch, but the pain goes away very quickly. If you are sensitive or feeling some pain, it's very easy to cool the area before and after to sort of help with some of those symptoms. So now let's talk about downtime. One of my favorite things about Botox is that it has very little downtime. A lot of my patients get it during their lunch break and go right back to work. Full disclosure, I definitely have done this as well. You might notice very small amounts of swelling at the areas that Botox was injected. I kind of like to think of it as a very tiny bee sting, and this goes away in about 15 or 20 minutes or so. Also, after a procedure, you pretty much can go along your day with a couple exceptions. I don't recommend napping because I don't want you to lay down and for that Botox to move. I also don't want you working out rigorously. I also don't recommend getting any laser procedures or facials right after. Just wait a few days for the Botox to set in. Other than that, really no restrictions. So now that you've got the Botox injections, when do you expect to see results and how long does it last? So Botox itself is not an instant gratification procedure. It takes a few days to see some results, but a full 2 weeks for the full result to kick in. In the first few days, especially if you're new to Botox, you might feel that your forehead feels a little bit heavy, a little bit tighter. This is completely normal. It's also normal to notice slight asymmetries in your face when you get Botox, especially for the first time. This is something I always counsel my patients on because all of us are asymmetric. We might just not notice it much. But when we're looking at our face a lot, especially after we get Botox, you might notice very small asymmetries. It's very easy to correct this with Botox, but I do recommend waiting a full 2 weeks to really see how the Botox is kicking in. Botox itself is also not a forever procedure. You have to repeat the treatments to maintain results. For most people, the results last between 3 to 4 months, and this goes for the most common brands that are used, include Botox Cosmetic, Jeuveau, Dysport, as well as Xeomin. There is one longer-acting Botox on the market called Daxxify, and those results last about 6 months or more. But for the most common brands of Botox on the market, I'd say 3 to 4 months is safe. So now let's talk about safety of Botox. Now in terms of safety and side effects of Botox, the most common side effect from Botox is having slight pain with the procedure itself, like we talked about, or even having a little bit of a headache right after the procedure. This usually goes away pretty quickly for patients, or you can even take a Tylenol or Advil if this happens to you. In terms of adverse effects from Botox, with a skilled injector who knows their anatomy really well, it's really rare for something to happen. But some reported side effects include a heaviness of the brow or even a lid lag. These can be corrected, but usually it takes some time for Botox to wear off and for these side effects to go away. In the case of an eyelid lag, an eye drop can be used to sort of raise up that eyelid. But again, these are very uncommon, especially with skilled injectors, but it's something that you should just know. This is why it's even more important to go to someone who is highly trained in the procedure, knows what they're doing, and has a really good understanding of facial anatomy.